Gandang gabi. Gandang gabi sa lahat. I'll try na gabi ako magbasa kasi nung kaninang umaga, dami talagang hindi maasahan na mga gagawin. Kaya try ko magbasa this evening. Wala masyadong distraction bago ako matulog. So pagpapatuloy natin yung about breast cancer. So conventional treatments. The most suitable treatment will very much depend on what stage the cancer has reached in the prognosis. Choose choice of treatment will also be influenced by your age and general state of health. If you are elderly, for instance, your metabolism will be slower than a young woman's, and the cancer likely to be much slower in growth. So invasive treatment could well represent a greater danger than the tumor itself. Surgery. This can range from a lumpectomy, lumpectomy, Kamusta? Okay lang ako, Makmakski. Busy kaninang umaga, kaya try kong magbasa today. Ikaw, musta ang pagsasaka? Breast ca- Nagbabasa ako regarding breast cancer. Kumusta ang pagsasaka, Max Maxki? Basahan kita ng breast cancer. Basahan kita about breast cancer. About ano kasi itong binabasa ko regarding sa Women's Health Bible. Dito na ako sa about breast cancer. Sige, basahan kita. Surgery. This can range from a lumpectomy, removal of lump and some surrounding tissue, to a total mastectomy, removal of entire breast. So, yung lumpectomy, removal of lump, yung mga bukol-bukol. Basahan mo ko about sa chest. Hindi, kasi ito yung ito kong magpag-aralan. If then so, after diagnosis in the early stages, a lumpectomy is often very successful when combined with general health and stress management. Wala akong maintindihan dyan, uy. Ba't di mo makmakski? English to, so for sure maintindihan mo. Talino mo kaya. Yan ba about sa channel mo? Yes. Nag-focus ako dun sa libro. Pagbabasa ng libro. Ano bang libro ang gusto mong basahin ko? Yung pagiging pagiging chick-chicks. Magaling ng chicks. Suggest ka ng libro na babasahin ko sa next. Para yun naman yung bibilhin kong libro, saka babasahin ko para sa'yo. Ang bobo ko kaya, kalukuhan, alam ko, oy. O sige, magbasa tayo ng regarding sa kalukuhan. Gusto ko basahin mo na libre, paano mambabae. Kung merong librong ganun. Merong ganung klase ng libro, basahan kita, hanapan kita ng ganyan. Gusto ko basahin mo na libro, Paano Mambabae. Hmm. Hindi, meron akong ano dun, meron akong isang libro regarding sa regarding sa Men are from Mars, Women are from Venus. Doon, makikita mo yung characteristic ng mga babae doon. So, pwede mong pag-aralan. Pakinggan mo yon para alam mo kung ano yung kahinaan ng mga babae. Ano bang hinahanap mong babae? Ang hirap ko yo, delikado mang babae ngayon, Makmakski. You know na, iba na ang mga babae sa ngayon. Ano na sila, well-educated na sila. Kaya hindi mo na sila basta-basta maloloko. Kung gusto mo magplano na manloko. So, hanap tayo ng libro ng paano ang tamang pag-court. Nabasahan na kita. Chemotherapy. Hindi yan madali. Magkikemo. There is no doubt that the various chemotherapeutic drugs used to destroy cancer cells can be very effective. And if the toxic effects on the body were not so harmful, this would be a great treatment. Common side effects, which vary according to the mix of drugs in the individual, include nausea, fatigue, loss of appetite, hair loss, and a weakened immune system. However, there is much you can do to offset or combat the potential damage. It is unfortunate that people in the late stages of cancer are given massive doses of chemotherapy in a bid to kill the cells off. It's not that simple. Ha ha ha, seryoso to uy, ha ha. Seryoso, sure ka, seryoso ka? Paano masabi? Nag-aano ka nga, naghahanap ka nga ng libro pambabae. So, hindi talaga simple yung mag-undergo ka ng chemotherapy. Kaya, yung mga babae, kailangan talaga nila alagaan yung body nila. It's not that simple. Chemotherapeutic drugs drastically weaken the body. So, dapat malakas yung immune mo, lalo na kung inaano ka ng nag-undergo ka ng chemotherapy. The main organs, liver and kidneys, and other tissues struggle to return to their normal level of activity, and hence the immune system fails. Wow, nasa hospital ka? Nasa hospital ako ngayon, Lods, nagbabantay sa uncle ko. Ano nangyayari sa uncle mo? Lo, dapat nakamask ka at saka naka-face shield lagi. Radiotherapy. Iba din siya sa chemotherapy. Iba din yung radiotherapy. Makmakski, nasa hospital ako ngayon, Lods, nagbabantay sa uncle ko. Ganun din yung message mo. Inulit mo. Mahina siguro yung signal. Radiotherapy. This is a form of X-ray or radioactive zapping that precisely targets a specific location, including lymph nodes, burning the tissue to destroy malignant cells. It is a very useful treatment for cancerous cells that are not widespread, and as a precaution against any malignant cells not excised during surgery. It does not damage the rest of the body, but burned tissue can act as a burden to the immune system. Your body perceives the burned cells as dead, so it tries to summon up antibodies to deal with them, and also expect energy creating scar tissue. On the plus side, This stimulation of the immune system may work beneficially, like vaccination or a bout of infection does. Kaya nangyari kay Makmakski? Hindi na nakasagot. Integrated medical therapy. Sige, Lods, ingat ka lagi dyan. Bye-bye na. Salamat, Makmakski, sa pagdaan. Basa ulit ako dito. Ingat ka dyan. Nasa hospital ka pala. Tsaka yung uncle mo, wag mong anuhin. Kuha ka ng water. More water. Bye-bye. Bye-bye, Makmakski. Integrated medical therapy. I do not dismiss conventional treatment at all, but I do not believe they should be standalone answers. Integrating an appropriate form of conventional therapy, surgery, and or radiotherapy as the preferred options of less aggressive chemotherapy as well, if necessary. With a lifestyle that gives your body the strength to combat what has invaded it, both the cancer and the damaging treatments is more likely to reach remission and possible cure. Unfortunately, the doses of chemotherapeutic drugs are typically calculated by body weight and not by the individual's requirement. It is worth discussing with the oncologist the possibility of a lower dose of less toxic drugs. Some may be sympathetic, especially when they know you are making major changes in your lifestyle, so that the drugs are being combined with a good diet. Health building measures, stress management, and some supplements. This will be true integrated medical therapy. Diet. The principles behind these guidelines are simple: good nourishment, easy digestion, and elimination so that your body's energy and resources are not unnecessarily diverted. Maintenance. The illness and the worry are likely to make you lose weight, and you should keep up your reserves of energy at times like this. I recommend the following. Read and follow carefully dietary advice in the lifestyle program. Eat organic food whenever you can and make sure it is as fresh as possible. Vegetables and fruits, in particular, begin to lose their traditional value as soon as they are peak. Mm. Eat organic food whenever you can and make sure it is as fresh as possible. Vegetables and fruits, in particular, begin to lose their nutritional value as soon as they are peak. Mm. Raw fruits and vegetables supply potent enzymes, and many are richer in certain vitamins and minerals than when they are cooked. Make sure you are getting sufficient protein, example, fish, egg, and chicken, especially if you are underweight. Following the lifestyle program means avoiding excess salt and sugar in fried foods. However, these all add flavor to food, and if your appetite is poor, bland food won't help, even if it is easy on the digestion. Stimulate your appetite with flavorsome herbs and spices. Have regular meal times and never too late in the evening. This might affect your sleep, and sleep is an important healing factor. Prevent constipation with high fiber foods such as prawns, papaya, pigs, spinach, beetroot, and forage. Keep up your fluid intake to help flush your system. Drink 1.5 to 2 liters of water every day. Massage. Many physicians think that because massage improves blood and lymph circulation, it helps to spread the cancer, and so patients are often alarmed when massage is recommended. If that were true, then exercise will do more or less the same. It is important, though, that any massage is done by a trained massage therapist who knows about your condition. Correct massage aids the healing process because of the sense of well being it brings. And this is extremely important for healing because the body and mind are then in an optimum state to function better. Feeling good motivates the body to heal itself. And for energy, a super juice, carrot, apple, root ginger, fresh mint, and sprouted beans, seeds, alfalfa, or wheat germ or bean sprout. This helps to energize the body and keep the bowel movements in order. Almond. Soak beforehand for 24 hours with a little honey in the morning. Ginger tea. Either slices of fresh or a spoonful of powdered ginger added to hot water with or without milk with honey to taste. Exercise, relaxation, and meditation. Hatha, 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 hatha yoga. Hatha yoga, with its calming breathing techniques and ability to still your mind and calm your body, is exactly what you need. The pace of life is fast, the level of anxiety in society is very high, and your personal anxiety levels are probably going to be sky high. You need an antidote. The living yoga through the day routine are sufficient to keep your mind and body in tune with each other, but you might also like to go to a regular yoga class or engage a teacher. Meditation is an important role to play in healing process too. It is a powerful way of relieving the inevitable stress, inducing a state of calm and well-being, and many people recovering from cancer have found it has brought them the strength they need through a difficult time. No cancer therapy can be complete without incorporating relaxation techniques. There are many techniques through which you can learn to still and control your mind through relaxation, breathing, and meditation. Ganda, ano? Nakakaano ng ano, concentration. Yan. Supplements. The toxic drugs used in the chemotherapy give the liver and immune system a heavy battering. The need to micronutrients is greater as the body tries to rectify the damage as soon as possible. But this is often hindered by a loss of appetite in an under-functioning liver. Boosting your supply of nutrients with vitamins and mineral supplements helps your body to carry out its normal functions and creates the feel-good factors so necessary for cancer therapy. To maximize your intake of nutrients, it is worth considering intravenous infusions of vitamins and minerals administered by the doctor before and after chemotherapy. The effectiveness of this therapy is often debated, but patients do feel better for it and find that the effects of chemo and radiotherapy are not so devastating. The supply of these nutrients helps the body to spread back more quickly to the level of well being before the chemo or radiotherapy treatment. Oral multivitamins and minerals can be taken in between the infusions as a general nutritional boost. Over the past decades, I have met many survivors of breast and other cancers who refuse simply to go along the prescribed path of chemo radiotherapy and have had amazing results. Gerson therapy, natur- naturopathy, and various herbal therapies have produced many successes. It should be stressed that many have not been successful as with many conventional treatments. Unorthodox treatments are generally not looked upon favorably by conventional doctors, and trials have proved difficult to conduct fairly. A trial testing natural methods carried out in a leading London research institute ended disastrously. It appeared that only terminally ill patients were given the opportunity to try unorthodox measures, whereas the group receiving conventional treatment consisted of patients in varying stages. The rate of survival in breast cancer is far better than many of other forms of cancer. Many doctors have begun to recognize the power of other treatments, sometimes in combination with orthodox treatments. There are many success stories, and these are called spontaneous remissions or anecdotal cases. Whatever the term for them, the success stories are out there. A further consideration is quality of life. It is important to make informed choices and follow the line you feel most happy with. There are times when the pursuit of extending life in any form is worse, for those around you as well as for yourself, than pursuing a high quality of life. Further thoughts. When I was a when I was a medical student in Moscow, the head of the Department of Anatomy was doing research on the microcirculatory network of blood vessels and proceeded to more growth. She found that the network of blood vessels began to multiply rapidly, like branches of tree. Before cells began to grow on them like leaves or buds, she felt that if there was any permanent cure for cancer, it would be identify these areas where blood vessels begin to branch and block them. No blood supply means no to more growth. Today, more than 30 years later, scientists are looking for ways to do that. Breast cancer will be a primary candidate for such treatment as the area is more easily accessible than, for instance, deep in an internal organ. So, mga babae, careful talaga tayo, alagaan natin yung health natin para mas maging matibay. Mag-continue natin yung mga purpose natin sa life, yung mga goals natin, mga dreams natin, especially those na may family na meron ng mga inaalagaan na baby, mga anak. Careful kasi lalo kung halimbawa may problema sa breast, so hindi makakapag-dede si baby. So, that's all for tonight. Thank you. Thank you for listening. Sana meron din kayo ulit natutunan sa channel ko, sa pagbabasa ko. Thank you kay Makmakski na dumaan. Sana maging okay na yung uncle niya na binabantayan para maging okay na yung situation, makalabas na sila sa hospital. So, that's all. Good night, everyone. Bye-bye.